Hello, I'm Robert, a fact checker and science blog and helping people who are scared of things. And this is about what the United Kingdom is doing right now, which is that we have decided to vaccinate people with a single dose first, and then maybe leave it as much as 12 weeks before the second dose of AstraZeneca or Pfizer. And that's even though they only tested for a second dose 3 weeks later. So why does that make sense? And actually, although it may seem quite a strange thing to do, I've checked with the experts and on Twitter, and most of them are saying that this actually makes sense, given the very dire situation the United Kingdom is in. So the situation is in the United Kingdom that we've had very high cases, and we've had Christmas where Boris Johnson said it's okay to gather together more than usual at Christmas, people who haven't met before. We've had New Year, we've had people who have not been following the restrictions, illegal parties, a demonstration. There was a case of a junior doctor working at A&E in a major London hospital, and as he comes out of A&E treating with very urgent emergency cases of COVID people, he comes across and videos a group of protesters who are milling around, no masks, no physical distancing, wearing banners saying it's a hoax. 4 weeks from now, he'll be treating some of them, and some of them will be dying in that very hospital that they are protesting outside. This is what's happening in the United Kingdom today. So this is the very desperate situation, and the intensive care units, they've got to the point where they're already having to take patients from Kent, and they've got to send them hundreds of miles away, right across the country, to where there are free ICU beds. Now, the situation is not the physical equipment. We're a wealthy country. We can easily get together a lot of ICU beds and all the equipment. The problem is the trained staff. We don't have the staff to look after them. And many of the staff we do have, they are actually sick themselves because of the very intense community spread. The situation in the United Kingdom is far, far worse than it was in Wuhan and in Hubei province. I think it would be quite, if you had Chinese doctors coming from here, they would be taking much more of a risk coming to the United Kingdom to treat people than they took going to Wuhan. That's the situation we're in the United Kingdom today. So you've got to take great care with protecting yourself. Don't do what those stupid people do. People who have just not understood. They totally don't understand the situation they are in. So, in this situation, then it's a very exceptional situation where we risk hitting the limits. We already have too many people in ICU care for the people who are looking after them. Instead of just one expert to 2, it's 1 expert to 5. There's a higher risk of them dying. There's a higher risk of dying in intensive care when you've got one person who's got to look after 5 of you. And every breath depends on their specialist expert attention. And people can't be trained up to that. So that's the desperate situation we are in the United Kingdom right now. Far worse than it was in Wuhan. They never got as bad as that in Wuhan in January. So this is the situation where they're but the great news is we've got these vaccines, and if we can roll out these vaccines quickly to the most vulnerable people, elderly people over 90, also to healthcare workers, because they are at great risk of being infected in these very difficult situations, then we can greatly reduce the deaths and intensive care cases for people in hospital about, now you've got quite a long gap, but now if you look at this, if you look at the first dose, so I'll explain why it makes sense. So if you take people who got the vaccination 3 weeks ago, then about 8 to 10 days later, this is what happens if you've got a placebo group not vaccinated. Then it's just going up and up and up. These are the cases going up, and these are the days, and these are the cases. And then the blue group is vaccinated. Now after 8 to 10 days, you can see it immediately levels off. And the second dose would only take effect at 28 days. This is Pfizer. And you can see that you don't even see any change in the curve, particularly at 28 days. So what's the second dose for, you might wonder? Well, the second dose is to trigger your memory B cells. It's to tell your memory B cells that this is that you need to remember these antibodies. And actually, your memory B cells are not all formed yet at 3 weeks. And the experts say that later on you'll have more of these memory B cells. So it actually makes sense to put your second dose that's going to trigger the memory B cells later on, after 3 weeks. And so one of the experts that I follow on Twitter, and he asked the other experts, has anyone know of any case of a disease where vaccinating in less than 8 weeks, if you're vaccinating in 3 weeks, gives a second dose, gives a better effect than a second dose at 8 weeks? He couldn't think of one. And in that Twitter conversation, none of the experts he was talking to, at least at that point, could think of a disease where vaccinating at 3 weeks would be better than vaccinating the second dose at 8 weeks. So that's the context. Now, what Pfizer say is they say that at 3 weeks, then that's what they tested. They tested for 3 weeks. But there's no, it could be that they just chose 3 weeks so as to have the vaccination over quickly. There's no particular reason to choose 3 weeks. Moderna choose 28 days or 4 weeks. And so Pfizer just said, we haven't tested beyond 3 weeks. We can't guarantee that it's going to continue. But if you ask expert virologists who know all about the topic, then they see no particular reason why 3 weeks would be optimal. In addition, we've got data from Moderna in which they looked at people. Moderna had a 28-day, which means that it would be 35 days before the second vaccine would start to take effect. So they have a window between 14 days and 35 days. And they looked at that window and they found 90% effectiveness after 14 days to 35 days. Now that's a very significant window for the United Kingdom because of the desperate situation we're in. And we are not being able to vaccinate as many people as we hoped. So if you can do single doses and keep on doing the single doses on and on and on, then that gap of 14 days from, for instance, someone vaccinated now, from 14 days now to 35 days from now, to have 90% protection during that gap, no matter what happens after 35 days, it's going to be reducing the, so if you take, for instance, 14 days to 35 days from now, so it's the beginning of February, and then you've got to add to that about 5 days for half of them for the incubation period, and then about 3 weeks before it goes to intensive care, it's usually towards the end of the 3rd week. So if you add getting on for a month to that, then you get to the time period for 5 days from now would be, and then from today, so if you go from today, then you go forward 5 days, and then you go forward 3 weeks, then by the end of February, then someone vaccinated today is going to be cutting down on intensive care units and on the deaths. And then if you look at the ones that were done 3 weeks ago, then by the middle of January we should already start to see a hit on that. And that's going to make a huge difference. It's going to, just by freeing up ICU beds. And if we don't do that, we're going to have deaths from people just not being able to look after them properly. People who would otherwise be saved, but they're just so pressed, and they get tired. And we've seen this before in places like Italy. They get too tired and they make mistakes looking after ICU care units, in ICU care units, working on long hours, and in their protective gear, which gets very hot. So that's really the problem. So in this situation, and it is emergency use authorization, so you have more flexibility there too, because it hasn't been through the full process of authorization. We believe these vaccines are very safe. There's lots of good data for them, especially for people who are at risk of COVID. Then very strong balance, very, very safe vaccine. So many cases, much more test data than we would normally have for a vaccine at this stage for emergency use. And so they're very safe vaccines, and then a single vaccine will give double. So even if it was only 50% protective, and it looks like it's more like 90% protective with a single dose, then if you can do twice as many, then anything more than 50% is more protective than even 100% protective one after 2 doses. So even if it continues beyond the 21 days, 90%, it gradually drops off to 50%. That does not very likely, even over 3 months. It still would be better to vaccinate twice as many. So when you look at it like that, it's actually a sensible decision. It's not likely it drops off to 50% in less than 12 months, 12 weeks. That's very, very unlikely. So you're going to be saving lives, saving intensive care units, and then meanwhile increasing the doses available, ramping up on vaccines, doing tests of doing one vaccine followed by a different one, which typically increases the effectiveness. And so then as soon as we can, we start doing the second doses once we've got plenty enough so we vaccinated all the most at risk. The top priority is to get a first vaccine out to everyone who is most at risk. Now, so that is the argument, that's the reasoning why, and I think it makes a lot of sense, and most of the experts are saying this. Now, the thing that you've got to do as a person is, and so I gave some quotes of different people, and for instance, these are childhood vaccinations, and there's one hepatitis B, you have the second dose one on after the first. Usually it's 2 months, and then this is for children vaccinated close to birth, or 3 months, and then in some cases it's several years. So it's there aren't any vaccines that you vaccinate only after 3 weeks in this chart, and most of them it's 2 months at least. So that's an example of to show that really it's very unlikely that 3 weeks is better than 2 months or 3 months. Now, there's one I want to mention, Angela Rasmussen. She says, so part of this is the response, is people say it's in response to the new variant. Now, I don't think the new variant has much to do with it. I talked about this group of people outside protesting and not doing physical distancing, and for weeks, for months, I live in a remote part of Scotland, and there are not so many people here who don't, especially all you do is you wait in the shop to the village shop, and everyone is dutifully keeping 2 meters apart, and they're all wearing their masks, except I did see one person in the shop who took off his mask to talk to the shopkeeper. I mean, incredible. That's the very point at which you should be, that's what you need the mask for. And luckily there was a kind of pain between him and her, but it was the very stupid thing to do. And so many people just don't understand why you wear a mask. They don't know what it's for. They don't have a clue. It's not. And then they don't understand. So I talk to people with my help for the Doomsday Debunk group, and they talk about what other people are doing in their area. And in London, I mean, so many people are they're not wearing masks, even in shops. They don't wear the masks. They don't wear the masks when they're talking to each other. They wear them around their chin. They talk to each other very close, and they get the idea that if you're out of doors, it's okay to be close because it's ventilated. That's not true. You've got to step back wherever you are. So anyway, so you protect in the same way as so this is what Rasmussen is, Dr. Angela Rasmussen is saying, that about this whole fuss about the new variant. Viruses don't evolve to get around masks, distancing, or disruption of the virus particle by detergents or disinfectants. Mutation doesn't defy the laws of physics. This is just the same, it's the same virus. It's not suddenly going to be and she says it's not going to become like a X-Men Superman thing. She says that somewhere. If it turns out this increased shedding is how it becomes more transmissible, and that's not proven, it doesn't change the path forward. And then she says, rather than tinkering with vaccine guidance or advocating for pointless travel restrictions, the travel restrictions are utterly pointless. The only reason the United Kingdom has had it since September, if it was so very transmissible, which is there's not such strong data for that, then if it was so rapidly transmissible, if you look at the D614G variant, that was over the whole entire world over the time period from September to now. If this was as rapidly transmissible as D614G, which was not only a small increment in transmissibility, if it was, everywhere in the world would be this variant. That hasn't happened. That is one of the reasons why I'm very sceptical that this is particularly transmissible. Just a slight edge, I think. I think there's some problem with their data and how they're interpreting it. Personal view. And she's obviously sceptical, at least sceptical about it. She says even if it turns out that it is. And so she's, that emphasis on is, she's not convinced, She's one of these people who's waiting for the more science to come in because it's not proven yet. But if it is, then it must be all over the world already. And the only reason we're detecting in the United Kingdom is because we do more gene sequencing, full total genome sequencing, than the rest of the world put together. That's why we detected it, probably. It probably didn't originate here, or if it did, then it's everywhere else already. So, for you, the personal message for you, if you're listening to this, do the physical distancing, wear the masks, and spend at least, most of you will have heard me say this already, spend at least 5 minutes of your time learning how to wear a mask. If you look on television, so many people touch the front of their mask to adjust it. They lift it up and down from the front. You can know for a certainty that none of those people have spent even 5 minutes of their time looking up how to wear a mask. Which amounts to just about everyone. Public figures, just about everyone. Just only occasional doctor or health worker or nurse that you see wearing a mask wears it properly. Nobody else does that I've seen. I can't think of an example of someone wearing the mask properly on TV. Well, I notice the ones who don't anyway. Maybe there are a few. I think there might be a few, but it's quite rare. So spend 5 minutes learning look up how the World Health Organization say to wear a mask. Look up how they say to wash your hands. You need to do it the right way. Learn how to physical distance and always automatically physically distance. And you're protecting yourself far more than if you got vaccinated. If you do that. and you should always automatically step back unless you're forced into a situation where, because of your job, and sadly we help people in the group, children at school, and we've been following it since January, because people in the group were already scared of this virus in January. And so I've watched every single World Health Organization press briefing since January. 5 hours, more than 5 hours a week in the original, because the press briefings are typically more than an hour. 5 sessions a week, and then 3 sessions a week. Recently 2 sessions a week. I've watched every single one all the way through. I may have been 1 or 2 that I've missed that I haven't watched all the way through. I think just about every single one I've watched all the way through and taken notes and listened to it carefully, as well as the social media Q/As. And then I write these blog posts for many of them. I talk to the group about it. Many of them listen to some of the press briefings and listen to social media Q/A. They're very clued up, the people who've been following the group since then. And they're in the United Kingdom, and some of them are school children. And the government, our United Kingdom government, is not permitting them to protect themselves. They go to school and they're not permitted to physically distance in communal areas, and they're not permitted to wear masks in the classroom, and they're very concerned. They're not so much concerned for their own health. They know they have a low risk as a child. They are especially concerned about giving the disease to their parents and to their household. And our government, I think it's not a scandal, doesn't permit them to take basic precautions in school. It's awful. That is why this is spreading, because our government isn't taking it seriously and is not communicating the basic precautions, and they're not even permitting children at school to take these basic precautions. That's why it's spreading so fast in the United Kingdom. That's just a symptom. Probably not most of the spread is through schools, but it's a symptom of the whole attitude of our government, that they are not taking it seriously enough. And when you've got examples like that, if your children are not permitted to distance, then is it a wonder that the parents are not taking it seriously, the ones that haven't been following it all the way through? Anyway, so that's the situation. But given this absolute desperate situation we're in, far worse than Wuhan was in January, then this single dose does make sense, I think. It makes sense because it will reduce intensive care unit cases starting in mid-January from the vaccination we've had already, going through to February, March. It'll be twice as many people vaccinated, and the people vaccinated will have 1/10 of the risk of getting COVID-19. And if you can vaccinate all the most vulnerable, then it'll be a huge reduction in intensive care case units, and will start to at last free some intensive care space sometime in February, March time, and start to maybe make a slight dent on it in January and reduce the deaths. So to do that with twice as many people. But the reason we're in this situation is not because of delay in the vaccines. The reason we're in this situation is because the absolutely appalling way that our government has dealt with this right from the beginning, from in March, when they stopped doing test, trace, isolate, and all the way through they've been arguing with the scientists, not following the scientists' advice, even their own scientists. They've been keeping things secret. We get the experts saying, what is your reason for telling children to return to school early in January instead of taking an extra fortnight like they're doing in Scotland? And they haven't released the evidence that it's based on. And this has been like it all the way through, for months. One decision after another, they never explain why they do it. The United Kingdom government has been far more secretive than China. Indeed, China's been very open about this. And for our government to complain about China and claim that they're covering things up, I mean, it's our government that doesn't explain anything. not straight away. They don't have an open, a lot of it is based on things that have never been through peer review even, and never even been a preprint until after the decision. And that's what's happening in the United Kingdom. And I think Boris Johnson, he should get on the phone to New Zealand, to Jacinda Ardern, and say, we're not managing to stop this, what did you do? And he should follow Jacinda Ardern. Not only that, he should get on the phone to the Chinese. The Chinese were very rightly praised, not the Chinese government, the Chinese health workers, the Chinese epidemiologists. These are medical professions, they're saving lives, just like medical professionals everywhere in the world. That's who the World Health Organization were praising. They did an absolutely excellent job. They discovered a tiny signal of 40 cases or so in very noisy data. Compare that with the United States. They had a secret outbreak, they had a hidden outbreak they didn't notice for months. We now go back and think that maybe that cluster of unusual pneumonias in the United States was a Wuhan-style outbreak that they never even noticed. And yet they criticize China for being a day late. And the whistleblowers in China, because they were aware of SARS and they knew what to look out for, those people in the equivalent doctors in the United States had never seen such a thing before. They never even thought, even though we had it in the news for months. Yet the United States never noticed it. So China did an excellent job, very, very fast, how fast they noticed it. And only one day later that the automatic system they have for detecting unusual clusters in winter, when you have lots of unusual pneumonias throughout, lots of anomalous pneumonias, they got one little cluster, and they said, oh, this is something strange going on. And the doctors on the spot immediately noticed it. They noticed it one day before the automatic system brought it up. So Boris Johnson, he should be on the phone to China and say, you're the absolute experts on COVID. You stopped it much faster than anyone else. You know what you're doing. Can you come here and advise us? Can you send us a team of Chinese experts to come to the United Kingdom and advise us how to deal with this? And they've learned all sorts of things. That our country made mistake after mistake after mistake. Starting off with that they did nothing to protect people in care home workers early on, even though Italy was warned them, look out for your care homes. And then China, way back in January, was saying, look out for this sort of thing. And our government just didn't listen. And then outbreaks in hospitals. Everyone has been warning, you've got to test, trace, isolate in hospitals. And our government has been just very careless. And so that's why it's gone wrong. But this is why it's very, very important that we do something about it. And so I am totally with Dr. Angela Rasmussen here. What we should be doing, okay, tinkering with vaccine is going to help with the intensive care unit cases in a couple of months. But if we were to really go for it and explain carefully to people why you physically isolate, why you quarantine as well, because many people, they don't get tested if they have symptoms. They haven't a clue again. Epidemiology is not obvious if it's not explained, although it's obvious once it is explained. So they don't understand why they have to get tested if they've got symptoms. They don't understand why they have to isolate. And yet they wouldn't dream of going to a COVID-19 ward without any protection equipment. Yet they are looking after a COVID-19 case in their own house without taking any precautions. They don't realise, they think of it as like flu, they don't realise that they are not necessarily infected at all. In fact, most likely, even once they've tested positive, 71% of people who tested positive don't infect anyone. And I help people and they just say, my partner's got COVID, I must too. And I say, no, you probably haven't. And they don't know that. And they don't have a clue that you should be protecting yourself at that point. Even if your partner's tested positive, you should both be wearing a mask. A clinical mask, disposable mask, throw it away every day. know how to wear it, know how to take it off. And you should be physically distancing as much as possible. You should be cleaning the door. They should be in a separate room. You should be cleaning the handle of the door every time you go out. Wash it. They should use the bathroom separately and wash it. People in the United Kingdom don't know this, and they don't understand. They don't know that you can contact trace by just yourself. You don't need to wait for the contact tracers. Look for everyone you've been in contact with for the last 2 days, and then without physically distancing. And if there are people like that, and especially for 15 minutes or more, then get them on the phone right away and say, I've tested positive. You know, if you've been quarantined quickly, then you can isolate away from your family, and none of them will get it if you can quarantine quickly enough before you even develop, at least 2 or 3 days before you develop symptoms, because it's got a very long incubation period. Then you can completely stop it if they can quarantine quickly enough. Most of them will stop it, and there's no opportunity. And what I just said to you just now has not been explained. Most of the people I help in the United Kingdom don't know these things, and that's what we should be working on. And Mike Ryan says that he doesn't think anyone in Europe, any of the countries in Europe, are doing the isolation and quarantine systematically. And 80% of the transmission is in households. If you're not isolating or quarantining away from your own household, you can only stop 20% of the transmission through isolation and quarantine. So our government is focusing very hard on only 20%, and they're not explaining what's needed to stop 80%. It's no wonder that it doesn't have much effect. They should really be isolated, offering free hotel space so that people can isolate away immediately and quarantine away immediately away from their home. Anyway, so that's what we should be focusing on. And so I'm totally with Dr. Angela Rasmussen on this. That tinkering with the vaccine, okay, given our desperate situation and given that our government is not doing what I just described, then this is our way of reducing the amount of intensive care units and deaths. But if we do what I just described, you can drop cases per day tenfold in 25 days. In 50 days, 100-fold. In 75 days, 1,000-fold. That's what New Zealand did. Well, New Zealand did the tenfold reduction in 25 days. And Wuhan, they did a very fast reduction as well, doing what I explained. There's a delay of a couple of weeks before you notice the changing in the cases, and then it just goes off a cliff. So that's what we should be doing. I haven't had a single leaflet through my door. I watch the BBC for my news, and they have endless adverts for their own products, a weather app, This Day in History, upcoming programs. If you watch anything on iPlayer, you get a trailer of another program before it. I haven't seen a single thing in any of these things that happens every day, nothing about COVID. They should have multiple COVID there, replace at least some, maybe half of them, maybe even all of them if they're really serious, and explaining what I just explained. And this hand-face space ad, it doesn't explain anything. At least, certainly the people I help, they don't have a clue. Just don't have a clue until they come to our group, and then we say, you know, listen to, and so the thing is, please, if you're listening to this, please tell the people that you're in contact with, to anyone, but spread this message. Make sure that everyone knows this as much as you can. But don't say, I'm an expert, if you're not. Unless, of course, you're Dr. Fauci or something. But if instead, say, put them in touch with the expert information. Say, contact the World Health Organization. Look at the World Health, listen to the World Health Organization social media Q/A's. They are excellent. Go, if you want to learn about how to wear a mask, go look what the World Health Organization say, what they say about quarantine, what they say about isolation. And sadly, in the United Kingdom, the NHS don't give very good information on this. They don't link to the World Health Organization. They don't properly explain all the details of how to do isolation and quarantine. And they don't really explain, I mean, some things, wearing a mask, I suppose, but I strongly recommend to go to the World Health Organization for the really most thorough, most detailed advice on how to protect yourself and your household. And things also like this US CDC is also excellent and good, especially for like symptoms of COVID-19 and what serious things to deal with, and other things like physical distancing and everything. They have a much better organised website than the NHS has. So that's good as well. And of course, I mean, there are good things in the NHS. Their description of the basic symptoms of COVID-19, for instance. But it's then and how you know whether to get tested. That's very clearly presented, but they don't really explain very well about quarantine and isolation. Not what I've seen. Not with the thoroughness of the World Health Organization or the US CDC. Anyway, but help put people in touch with the best information and with sources of good information, and then say, go and find out, go and watch. Don't take me. So what I just said, don't go by what I'm saying. Check with the experts and make sure you're in contact and reading what the expert advice is. And so I'm just doing my best to make that connection. And then a very important thing though, that's a psychologist friend helped me with this. So I don't know why this is not being explained. So there's one thing that I'm saying that I don't hear other people say. And that is, it's called implementation intentions. I've never heard the word implementation intention used in educating people about COVID. And this is to do with COVID fatigue. So I think that people would do this properly if they did the whole thing about COVID fatigue is to do with making things too busy and complicated for your mind. So you haven't got simple rules. You are constantly thinking, is this the right kind of social situation where I should do physical distancing, or should I not? What will the other people be thinking about? And if this is someone who doesn't do physical distancing, should I make them an exception because they obviously like to be close? If you're doing that sort of thing, you're going to get very tired of it, and then soon you're going to give up. What you have to do is make it automatic. Always step back 1 meter. No exceptions, except for your bubble. And obviously if you're quarantined, isolating, obviously step back even with your bubble. And don't worry about a few seconds or minutes. Just step back, and it's 15 minutes makes your contact. Not that you're sort of 15 minutes. If you're less than 15 minutes, you're okay. But if you're 15 minutes, if you can step back within a few minutes, then it's because a single virus can't give you the disease. It seems to require several hundred, and it takes 15 minutes to get to that size of that kind of number that would get over to you. So, or lots of short sessions, each of a minute. So, just make it automatic. Always step back. And then if you find it difficult to motivate yourself and you think, oh, what a nuisance it is to constantly step back, try compressing the timeline. It's a kind of little trick. So people have no problem with making everything automatic when they're crossing a road. If you're crossing a road, you know that if you don't look both ways, you'll immediately be hit by a car. So there's no distance in time. So people take that very seriously. And in a city, you won't get people just wandering across the road, just relying on peripheral vision and all the sounds of car brakes shrieking or something to react. They look both ways every time they cross. Well, try and think about that with COVID-19, that if you were within 15 minutes, within someone close for 15 minutes, you're running probably a small risk. It's not a very high risk, but you're running a risk that you might suddenly, if you imagine it happening instantly, then think immediately if you collapse to the floor and you're so tired that you can barely get home, or you immediately lose your sense of taste or smell, or your mind gets so befuddled that you start saying, what's that thing? It's sort of drapery, it's sort of cloth, it's draping, it's hanging down. Oh, no, I can't think of the word, what is it? And you're thinking of the word curtain, but simple basic words, you can't bring them up to your mind anymore, and you're forgetting people's names. Imagine that going on for 3 months, or 3 months without being able to taste food, or tasting horrid, and having to force it down, even though it doesn't taste like anything. So imagine that happening instantly, instead of happening 2-3 weeks from now. And then imagine that instantly your granny dies, because you didn't do this physical distancing. Or instantly an old lady just way down the street. You've no idea who she is, but she just falls down dead. And it's a consequence of you not doing the physical distancing. And so once you start thinking like that, then that can help motivate you to do the physical distancing properly. And just always automatically, just like if you're crossing the road. Just think about these things being instant. Now, the risk, I don't want to overplay it, because, for instance, even for over 90, then 5 out of 6 people will probably just get it quite mild, and they're not going to die, and they're not going to need intensive care unit. Over 90, if you do need an intensive care unit, your risk is very high. But if you don't get to that point, then you can have just a mild infection like a young person. And then for a young person, then 4 out of 5 are just going to have it very mild. And that's why you get these people with clusters. So only one cluster in 3 of 5 people will have anyone there with long COVID, typically. And then they might have more than one. So I'm not sure about that number quite right. I worked it out a little while ago. I had to work again. But you get frequent clusters of 5. Oh yes, that was with 10%, I think. Yes. So if 1 in 10 people get long COVID, then something like 1 cluster in 5. For a group of 5 friends, most likely none of them have it. But 1 in 3 of the people who have a group of 5 friends, then one of them will have long COVID, and possibly more than one. And in the same way, if you're elderly people over 90, then you could have 2 clusters of 5 where nobody dies, and another 1 or 2 people die. Another cluster of 5 friends. So this is why people often get this mistake just from looking around and saying, well, I've got 5 friends and they're absolutely fine, so why should it's just like a mild flu. And then they go and tell everyone else who hasn't got any COVID cases, and so you get this misinformation spreading like that, just based on not being able to generalize properly from small numbers of cases, which is quite a sophisticated mathematical thing to do. And we're not very mathematical, and our evolutionary instincts are just not very good for this sort of situation. So this is very serious, and don't assume that because you've got 5 friends who didn't get it bad, that you're going to be okay. And just do continue to protect yourself, and that's far, far more important than getting vaccinated. And then do the physical distance automatically, do the mask wearing, learn how to wear the mask, wash your hands, learn how to wash your hands. Spend 5 or 10 minutes learning how to do all these things. Make them completely automatic. Always wear a mask consistently in the same way, in the same situations. And then get out of the habit of touching your eyes, nose and mouth. So if you possibly can, it takes weeks, sometimes it could take months, but eventually you get out of the habit. And that will help you long term too. So, but don't worry about small lapses. It's a case of continually working and getting more into the way of doing it properly, make it all automatic. And then you'll be able to keep going with this. So, I mean, I've kept going, I've made everything automatic, and I've been like this for however long it's been since it started in the United Kingdom. It's very easy for me because I'm in a remote place in the in the village, and I only go once a week into the shops and things, but still I've made it all automatic. And but I know lots of people I help, they do the same, made it totally automatic, and then it's much easier, much easier. And then you won't have COVID fatigue, and then you might feel it's a great nuisance. If you feel it's a nuisance, just remind yourself and try this little trick of imagining an old lady drops down dead if you're not doing the physical distancing. And then that will give you the motivation, just like if you cross a road, then you have this imagination that if you don't look both ways, you won't be hit by a car. So even though it's a very rare thing, and probably even if you were to walk across the street, the cars would most likely screech to a halt in time, and you wouldn't die. And it, depending on the situation, and if you've got a bit of peripheral vision, most times you'll notice even without looking. But you have that thing in your imagination, but I could be hit, so you look both ways. In the same way, have in your imagination, I could have long COVID, or if you're elderly like me, then I could die. And then also, or this old person who you care for, or a random old person in the street could just die. Think about it like that, and then you'll start to take it as seriously as do the physical distancing, as seriously as you take being careful to look both ways when you cross the road. So I suggest you think like that. Now, is there anything else I need to say? I've got lots of details here. Right, this is about how it's 90% effective. Let's just quickly look through and see if there's anything I haven't said here. It's about 90% effective with Moderna. I talked about that. I think I've talked about most of this. This is about the memory B cells. Remember I said that the memory B cells, that you've got more of those if you wait a bit longer. And this is an article about how we need to act decisively even in the face of uncertainty. And so in this case, it's not clear, we haven't got the evidence in, but this is enough evidence, I think. It's not likely it's going to drop off to 50%, even 50% effective in 3 months. If it does, we'll soon start noticing, and then we can then say, oh well, we've got to accelerate the second dose. But that doesn't seem likely, really. Basically, evidence so far, even though this isn't enough to be certain. And then these are all the experts saying these same things. And then show what should we do. So I think, and then there's an interesting proposal to randomize the second dose. And so this, I think, is quite an interesting idea. So by Jeremy Farrar, that we could use this as actually a basis for a trial. And the randomized is that you would actually decide in advance the randomization, so you'd have different cohorts, 1 week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks, 8, 10, 12, 16 weeks, and whenever someone gets vaccinated, you would randomly choose, say between 3 and 12 weeks, or 3 and even 16 weeks, and then that's when and then make an appointment on the spot. That's when they come back, and then you have these appointments spread out for a long time in the future, which will then give you many more vaccinations, and right now, first doses, and then you can just compare the second infections with all these different people and say, if there's a correlation between the longer dose interval with whether you get more infections later on for those. So why shouldn't the makes an excellent suggestion that the United Kingdom could use this, and basically it's a large-scale clinical trial. And there's nothing wrong with doing a large-scale clinical trial as long as you have informed consent. So I think what the United Kingdom should do, the proper way to do this, the people who've been vaccinated already, they haven't given their informed consent to take part in this trial, which is basically what it is. So the people who've been vaccinated already, I think they should be given, because they haven't given consent to a clinical trial, that they should be given their second dose after 3 weeks, as promised to them. But I think people from now on, they should be told you are enrolling in a clinical trial of the effectiveness of doses or randomized between 3 weeks and 16 weeks. We have no reason to suppose that if it's delayed even as much as 16 weeks, that the effectiveness will be less. But we need your consent, because we don't have proof that your effectiveness will be so much if it's the second dose is 16 weeks. So do you consent to take part in this trial? And then they've got the choice of either that or they don't take part. But if they don't take part, they're not vaccinated, of course, because we don't have the vaccines to. We've just got the vaccines for this clinical trial, and not to vaccinate people with the 2 doses 3 weeks apart. I think that's how we should be doing it in the United Kingdom. If they do that, it's all above board. It's just a very large clinical trial of millions of people. And there's nothing wrong with that. It's a very sensible clinical trial. It's a very useful one. It will help other people around the world to learn whether to find the optimal dose. And we'll find the optimal dose interval, whatever it is. Is it 3 weeks? Is it 10 weeks? Is it 12 weeks? The United Kingdom, with a very huge clinical trial, could find that answer. So I think that's what we should do, personally, myself. I think we just be upfront and honest and say, this is a clinical trial. And that's what we're doing. It's a very large clinical trial. And given our very desperate situation, the emergency use authorization, it is appropriate, and it's a very safe clinical trial. A single dose vaccine is not going to harm you. It's going to reduce your risk. And even if it's not necessarily, it's going to reduce your risk, we think likely 90% for the first, from 14 to 35 days at least. And very likely it does the same with AstraZeneca, or something similar. So we have this thing that AstraZeneca seems to be less effective. So maybe that's, but that data is quite scattered. But so maybe AstraZeneca is less, but it's still more than 50% for sure. And we just have to see what happens. I mean, might even anyway. No, I won't say anymore. So that's enough. I think I'm finished now. I don't want to. I put my foot in my mouth. I think if I keep talking about one thing I was particularly thinking about saying just then. So I'll stop at this point, and I think this is a better video than the one I did before. So I'm just going to supersede it. It's still quite long, but I think I said all the things I wanted to say. I said reasonably clearly, and I'm not sure if I can say much shorter than this. So I'm just going to upload this, and this is the video for it. Right, just my final piece. A shout out for Doomsday Debunked, which is our group on Facebook, and we very much welcome fact checkers and experts. If any of you expert epidemiologists can give a little bit of your time to help very scared people, then the people in the group very, very much appreciate any experts who've got a bit of time, though I imagine most of those who are really expert have got their time really full up already. But and if anyone good at fact checking, and then also if you're very scared, and if you're going to post in the group, rather than just reading the group, do please read the rules at the top of the group, which they're fairly straightforward things, and that helps to make it work properly. Hope this was useful, and thanks for listening. And I'll put the link to my article in the video description.